Good afternoon, and thank you for being here with us today. I am Silvia Legos, a specialist in communications for the team of communications in the county of Sonoma, and this is about the COVID-19. To begin with, we're going to give you a message for the people that speak English.
Which is being conducted in Spanish language. To listen to the interpretation of this presentation in English, please visit the County of Sonoma YouTube channel, where we will be live streaming in English. Thank you. Y ahora vamos a comenzar con algunas
So we're going to start with some good news. During the last week, we reached another milestone. I'm happy to say that 80% of the residents eligible of the county of Sonoma of 12 years old and above have received at least one of the doses of the COVID vaccine. That means that 72% of our residents have been totally, completely vaccinated, and the other 8% have been partially vaccinated. Even though our steps to vaccinate has been diminuted a little bit, the rest of the population has been well vaccinated, and so we will be back to. We've been getting about 1,000 vaccines in the county. Yesterday, we got 1,400 people vaccinated, which is great. But given the variant of the Delta variant in our community, we can't let our guard down. With the variant, the Delta variant is more contagious than other viruses that we had in the past, especially COVID. And so we're seeing and we're feeling the impact of that community. So it's imperative that we get the most people vaccinated as soon as possible. And so for that reason, we will thank the Board of Supervisors that have voted and have approved and have supported us in that people can show their vaccine card that they've been vaccinated or that they're willing to be tested a week. So once we get to this measure, we will hope to put an example that other immunizations can continue. We're very happy that a lot of people are doing it already. Some of the restaurants are asking for proof of vaccinations and before they're letting people into the restaurant. So it's very important that we work together to create an environment that it's a safe work environment for everybody in our community. And so we will keep looking for those who are not vaccinated. It's hard to do, but even though we keep using our clinics and events and we're doing events, in fact, this week after the state finished a contract that it would have, they were going to close our clinic in Roner Park. So they found the resources to keep it open, and it's going to continue operating and keep it open. So this is a kind of work as a teamwork that what we need to continue and assure that the testing is accessible and that the vaccines are accessible. The pandemic has not ended. The people keep getting sick, and it keeps bringing it to the community. So people still have questions about the vaccine, and especially the booster shots. But first, I want to let Priscilla Rodriguez, who is one of the nurses for the County of Sonoma, so she can give us a summary about the pandemic. Priscilla? Thank you, Sylvia. Yes, our campaign for vaccines is our most important tool that we have, to combat this pandemic. So we have a good example. Our cases that we have, it's high and it's circulating in the same, the number of cases, versus 100,000 residents, it's a little high. So between those people who have not been vaccinated, it's been 40%. And so because of these numbers, we will say that the rate of infections is higher than the people that have not been vaccinated versus the people that have been vaccinated. So also we know that those who are not been vaccinated, they have more of a possibility to finish in a hospital or to suffer the worst effects of the virus. More than 80% of the patients that are in the hospitals are people that have not been vaccinated. So 90% of the patients in the in the intensive care unit have also not been vaccinated. And our hospitals have been pressured to the point where they're running low in space. And so for as of Tuesday, 84 patients were hospitalized with the coronavirus. Of these 84, more than 20 are in the intensive care unit, and three times the patients, yeah, and three times the patients in the intensive care unit. So this also shows how important it is to get vaccinated, also to be tested, especially for those who are not vaccinated. So that let's talk about the testing. You know, given the increment of the Delta variant and the number of employers that are asking their employees to be vaccinated or to show proof. So testing has increased to 60% compared to last month. So the county of Sonoma has tried to do about 1,000 tests. Has gone from 1,000 testings a week to almost 14,000.
Molecular matrix y salud en Casa Fox.
These are the testing sites. These are the places that of the coronavirus that are helping the testing of the coronavirus. Please go to soco.gov org-test.gov to get more information about the testing, including the mobile clinics that are in your neighborhoods. A lot of these clinics are open weekly, and they have information about how to make an appointment. So now I'm going to pass it on to Dania. Thank you, Priscilla. And lastly, we'd like to talk about the booster shots. We know that that a lot of you
acerca de cuándo y cómo recibirán sus vacunas de refuerzo. Ahora que la FDA y
now that the FDA has approved the booster shots for those who have already taken the Pfizer or the Moderna vaccines, we know it's urgent, but we want to let you know that the efforts were approved for a very special group in the community. So these are
que tengan con cáncer y aquellos que reciben.
So only the ones that don't need have to take the test are those people who are like organ transplants or cancer patients don't have to take these. So there's a lot of questions in regards to the booster shots. And so the FDA of the US has authorized last week the third dose of the coronavirus from Pfizer or biotech or Moderna. So for certain people who have immunological system, and so it's important to underline that these efforts do not apply for all the people at this moment. This additional doses of RMA against COVID-19 should be considered only for people that have immune systems that are affected or that are moderate and severe for any medical condition, or because they receive some kind of a treatment and it makes their system, their immunological system is weakened. So please don't go to the clinics expecting a third shot. So we ask the residents first talk to your provider, your medical provider, to see if you should receive it, and if it is so, then make the arrangement with your doctor to make to get the booster shot. If you don't have a medical provider but you think you should receive it, please go to Victorino dot to the website that
un refuerzo antes de que pueda hacer
so
la
that'll
cita.
be confirmed that you can receive the third shot.
El presidente Biden anunció ayer que estaba
President Biden announced that we are ready to administer those booster shots for a lot of the residents in the U.S. And we should be getting them around the 20th of September. So we should get more directives and news about this directive. So just remember that this program is still developing and it should be approved by the FDA. And these plans will to apply the supports that the Pfizer, the Moderna vaccines, apparently they go down. The protection goes down with time, or diminish with time.
Serie de vacunas como todos los demás. Los datos de las nos muestran que las vacunas de Pfizer y Moderna.
Sorry, my connection is breaking down a little bit. So those that are fully vaccinated continue to be protected with the worst effects of the virus. In many cases, when there are cases of infection, the people don't show very serious symptoms and they recover very fast. We would love to answer your questions in regards to the vaccines, but first let's share a small presentation just to show you the statistics of where we're at. So we're going to show on the screen with you.
Okay. Miremos ahorita las tendencias generales que estamos mirando.
So this is the general tendencies that we have in the county. Right now, the metrics as of the 18th of August, we are still at 8%, 19% or 88% of positive in the general public. That means 19.5 new cases for every 100,000 inhabitants in the county, and we had 8.1% of positive tests in the lowest quarter of the HPI.
El cuartil,
so that means
las hospitalizaciones de COVID
the hospitalizations for COVID-19 are actually at 83 hospitalizations. 35 individuals have passed away due to COVID as of June 1st.
En esta gráfica estamos mirando en lo anaranjado.
So in this graphic, you're seeing the orange line, the people who have not 36.7 new cases of those that have not been vaccinated. And in the blue line on the bottom, we see the population that is completely vaccinated.
Anaranjados aquellos que no son vacunados y el azul es aquellos que son vacunados.
So remember, the orange are the ones that are not vaccinated. The blue is the people that have been vaccinated. So right now, recently, with the we've seen an increase of some cases for every 100,000 between the ethnic groups, between Native Americans, Native Alaskan, also the different ethnicities there. And so our total testings have also increased by 60% from the last month. So we've also seen that all the races, ethnic races, have been increased also in different geographical areas.
Estamos también notando aquí en el departamento de
We're
salud
also noting that
diferencia de
in the
percepción
health
de la
department
por
that
demografía,
the positive
elección
testing
por diferentes grupos étnicos, pero también
by different ethnic races
edad y geografía.
and
Y
also
solo
by
para cerrar
age and
y geografía,
geographical
pues, la
and
porcentaje
by
positiva
ethnic
se
groups.
mantuvo alta entre los residentes, la comunidad latina,
So the Latino community has have increased 15% and 13%.
Aumentó entre los residentes
In between the residents that are the white residents, 10%. And when we look at this by age, the positive increase has gone on all categories with more
5 a 17 años,
groups of 5 to 17, 18 through 24, and 25 to 34. And in geographical terms, the positive rate has gone up in Cloverdale with 27%, and El Rio at the Russian River, 30% has increased. Those are the two biggest increases that we've had. These are the these graphic bars. These bars are asking us about the new cases in the last 60 days. The first one that's on the left is showing by age of 20 to 29 years. That's the highest of 20.19%. And then, you know, each bar shows the age and the percentage that it's been going. So our biggest increase has been in the ages of 20 to 29 years old. So we should also talk about the variants. And right now, the 93% of all the cases that are new in the country have been attributed to the Delta variant. And that's the one that's the more dominant one of all the variants that we've had. The Delta variant is 60% more contagious and contains 1,000 times the viral charge in the virus. This is what's contributing to all the increase in cases. We also can see where we are in different areas where it's increasing. So we're usually in places where people don't have homeless or jails or camps for youth. The reunion represent about 20% of the new infections, where we're seeing those increases. That means like big reunions, family reunions, weddings, large events, sporting events, or even little league games. That's also the restaurants and bars have also increased. When we see the hospitalizations and deaths that we see in the county, we can see that 80, here in the yellow, you'll be seeing that 83 patients have been hospitalized for COVID-19. 13 of them have been in the ICU, 13 of them, and we have double the amount of patients with COVID and patients that have other different symptoms. 79% of the patients hospitalized of COVID-19 in the ICU are not vaccinated. 99. Most of the deaths that have happened, 99.7 of these people have been people that are not vaccinated. When we talk about tendencies and ages of people who have been hospitalized, if you see on the left, we can see how the pandemic has, the trajectory of the pandemic, that we could see that it affects more people.
65 años o más representó la mayoría de las hospitalizaciones durante la pandemia.
Ahora, in the past, yeah, one of the 65 and over were representing as the biggest number of people that were hospitalized. And so now we're observing the increases in groups of the age of 50 to 64 years old. Also, when we see tendencies of vaccinations by age, we can see those that the blue line is that are 70. The orange one says 65 to 74. So you can see the different age groups as to which ones are the ones that are. And you can also see when that the gray line, those are minors who are eligible for the vaccine. We see the proportion by ethnicity, the people who've been vaccinated. We see we also see again that we see that the Latinos are the ones that are you can see by the different ethnic races as people who, so the blue line is the line of people who have been completely vaccinated. The green is the people who have not been vaccinated. And then the gray, people who have been partially vaccinated in the green, and people who have not been vaccinated in the gray. So we are making some advances. We have a lot of changes weekly. So the number of people accumulated in the Latin community has gone up since August, between the 2nd of August to the 16th of August, to 3,595 patients or residents who've been vaccinated.
Entre el 2 de agosto al 16 de agosto. Nos da un total de 3% cuando se trata de aumento. Next slide. ¿Y dónde estamos en medidas de?
This is a measurement of vaccines. Actually, 25% of the doses of the vaccine has an administration has been administered to the residents in the fourth in the quarter. The graph on the right, it shows the first bars that these are the areas that were more affected by the pandemic, and how you can see the differences there between the two.
Okay, ahora se lo voy a pasar a la enfermera Priscila, que nos va a dar un poquito más información en adelante. Adelante, Priscila.
Gracias, Denia. Lo que voy a estar hablando es por qué están recomendando la tercera dosis.
We're going to be talking about why they're offering, they're suggesting to get a third or a booster shot for people who are immunocompromised. We would like to show that the people who are immunocompromised, who are completely vaccinated, they still show a certain amount of a percentage of people who have been hospitalized through the cases that are in the hospitals as of now. Lower vaccine effectiveness, VE among immunocompromised people versus 90 to 94% among non-immunocompromised people after second dose. We're also seeing that the effectiveness of those type of people is 59 to 72% compared to the ones that are not, that are suffering from some condition, has been 90 to 94% of the efficiency of the vaccine. So this one will show us, as you can see, it's a little complicated, but the blue line at the top, the broken line at the top, show how the immunocompromised, the immune system of a person is how it affects different people from different areas from these conditions at the bottom. Cancer, hemodialysis, organ transplant, immunosuppressive therapies. So the blue, this is a percentage of the people that could that were responsive with the antibodies, and we noticed that they're just a little bit below the dark blue is right below the line. And people who have hemodialysis were also represented that they responded well with the antibodies, but we also saw that people who had the yellow, with the yellow, people who have received a transplant, an organ transplant, did not have a high percentage of antibodies against after the second shot against the coronavirus. And the last one, the red one, people who have therapies or that affects their suppressive system. So we also saw that they have how it affects after the second vaccine. The next is just a table. This shows 5 studies about how the patients have immunocompromised systems and people who have received an organ transplant and the ones that have dialysis, how they responded after the second dose of one of the RNA vaccines. Most of them, especially on the ones that have transplant of organs, they didn't really create any antibodies after the transplant was received. So what we see on this table is that after the third dose, there was a little bit of an increase in that developed antibodies with the third dose, with the booster shot. So if we see an area where they could be more protected, this is why we are giving priority to them for the people who have this kind of a system, so that they can get a compromised immune system that's compromised. The last slide simply shows that the patients or individuals who have received the Johnson & Johnson vaccine, that it was just a single shot vaccine. We don't have the studies yet to recommend if there's a booster shot that's needed for the people who took or people who have an immunocompromised system. So we're still waiting for more guidance or more studies by the CDC. So this is so these are all our actual numbers. So what I'm about to share with you is a message that Dr. Chuck Village is sending. He's the medical director for the Providence hospitals here in Sonoma, 3 hospitals in this community. And this is his message. These are his words that he wants to send to the community.
Comienzo así, dice, por favor, vacúnense.
Please get vaccinated. Plus, also, I would like to ask you that if you are already vaccinated, that you talk to someone who is not vaccinated. Right now, there's 100,000 people that are not vaccinated against the coronavirus. And when we see the numbers in our hospitals, what I see or what we see in our census, that the numbers of the people in the hospitals is that number is similar to what we saw in December. What is different in comparison to what we had in December is that most of the patients that are hospitalized are younger people and they are not vaccinated. Also, we've noticed closely that the patients that are hospitalized, those are patients that got the virus from and were received the virus and died in our hospitals. We also saw that what's happening in our hospitals is that it's important that people understand that hospitals don't have the capacity to have transfusions. The number of transfusions that we've been able to accept have gone down 20%. Part of the reason for this reduction is the increment of patients that have COVID. We know that COVID is a disease that could be prevented. We have a sure plan and treatment, and that treatment is a vaccine. Again, once again, for those who are listening to this call, please, if you have not been vaccinated, get it done. If you have been vaccinated, then I am asking you to please talk to someone who you know who is not vaccinated and just share your experience to them. These are the words from the doctor, and I'll pass it over to Sylvia. Thank you for sharing that information. So now we want to ask if people have any questions or if any media has any questions. So if you could put it in the chat room, that'd be great so that we can answer your questions. So we have a question here. I'm going to make a question for Robin Hauscher. As an epidemiologist. So Robin, the question that we have today is people have noticed there's days when there are no new cases. Why is it that sometimes we don't show the new cases on the, do you have an answer for that?
No, sí, sí, sí.
¿Puedes
Sí.
repetirlo
Sí, Robin, sí, la pregunta es que el público ha notado de que en la tablera.
Yeah, the people have noticed that on the internet sometimes there's days that there's no new cases registered, so we want to, I don't know what the schedule is or why does it take so long for the information to get put on the internet? Was because the system, the reporting system is very big, and sometimes we don't have cases to report because we need more time to get the information. The system that we use already is to report the cases. They need more time to maintain the system, and it's a system that we don't have enough personnel to fix the system when the system fails, and sometimes for that reason, sometimes it takes a while to fix it. Sometimes it takes a while to fix it and then to report the new cases. Also, if Priscilla or Dania have any additional information that they want to go ahead and talk about, it's fine. That'd be great if they could jump in. There's another question that asked is when are we going to start the third round of vaccines?
Yo puedo hablar sobre eso. Así como hemos platicado anteriormente.
Just like how we talked in the past, the third round of vaccines or the booster shots that we've been talking about right now, these are for people that have a autoimmune system that is compromised. And so that's when we will be focusing on those first. And then, like we've also talked about in the past, the Biden administration has said that it'll probably be in about 8 months when we're going to look at that progress. And so right now, we just ask people that have a disease or an illness that is preventing from their doctor, or if you feel that you are eligible for it, to go to the myturn.gov to see if you can get an appointment for that. Also, another question that we have here that was made through Facebook is, if 8 people of 100,000 people have been vaccinated, are they still coming up positive with COVID? Why do we need to take the vaccine? What's the reason for having to be vaccinated? Especially if the vaccine is not shown to be 100% effective.
¿Puedo hablar sobre eso? Miré aquí la pregunta, dice, ¿por qué necesitamos que ponerla la vacuna? So, la vacuna no es 100%.
Yeah, so somebody was asking why do we have to get the vaccine? And we know that the vaccine is not 100% effective, against the infection. But we do see a large protection, that it protects the most severe parts of the disease, or it avoids being hospitalized or even your death, or that it won't take you to the intensive care unit. So if you say people think that the vaccines doesn't work, the vaccine works. They talked about all the numbers. The people that are in the hospital who are suffering are people who have not been vaccinated. So the people that are vaccinated, almost 99% of the people that have passed away, they have not been vaccinated. So those are the people that don't have the vaccine. So we noticed that the vaccine does work against this. It gives you protection for this, for a severe illness. And so we know it works. So we need to take advantage of it now that we have it available to us. Thank you for the question.
Perdón, Silvia, no te escuchamos.
Quiero agregar algo más. Yo pienso que
I wanted to add a little bit more, and also in part for that too is it's a theme that we like to talk about. How important it is to protect our community and to call our community. We want to prevent all the hospitalizations and deaths, like we saw on the statistics, especially with the Latinos. We are the ones that have been more affected during the pandemic. So we need to take under consideration and also take under account the importance to have this tool that is going to help us to come out of this, as winners. But as far as the clinical part, we should do it for the clinical part and the medical part, but we should also do it just for the caring part of the community. Also, another question that I received as a person that works at a restaurant asked me, so I don't know if we have the answer to this, but if the Delta variant is affecting so many families, why are we letting kids to go back to school? So I know that's very important because a lot of parents, they want to protect their kids. And so it's a question that somebody asked me, that a person that works at a restaurant that I went to this week. So I don't know if somebody has the answer for that. I know that a lot of parents are concerned about this. I can add a little bit to that.
I can answer that
We've
one.
been monitoring the increases.
Oh, I can answer that one if needed. So children are going back to school for a variety of reasons, and part of that is that it has shown that the majority of COVID transmission does not occur at school, and school is a generally safe place for children. And it doesn't just help, it helps the community also get back to work and allows parents to, it allows a safe environment for children to return to. And there is a lot of measures in place to help prevent the spread of COVID occurring at schools.
Gracias, Kira. No queremos confundir así al traductor que está traduciendo la información, pero lo que dijo Kira, una enfermera de salud pública con Condado Sonoma, dijo que lo que pasa es que muchas de las escuelas están seguras para los niños y que sabemos que mucha de la propagación no ocurre en las escuelas, sino en los hogares o fuera de las escuelas. Y discúlpame, pero no capturé toda la información. Dania.
Simplemente agregaría que basado en también la presentación que tuvimos ayer con la doctora Mays, enfatizó ella que estamos monitoreando esos números y el departamento de escuelas del condado de Sonoma también está checando los brotes, y como dijo Kira otra vez, hay métodos y prácticas en ahorita en lugar para asegurar de que las escuelas estén tomando
right
todas
here.
las medidas para que los niños estén seguros.
She's just reiterating everything that the other person was talking about. So that's why I wasn't interpreting. Sorry.
Es algo que solamente quería agregar, que fue mencionado.
Gracias, Deña. Priscila, ¿tenías algo que agregar a esta pregunta?
So is there something else that somebody wanted to add to this question? No, just the same thing that Kwakira said, that she works very closely with all the schools and the parents and point of contacts about if yes, the return of kids to school. Many people have anxiety about that, and I understand because we have this variant, kind of increasing. So we also notice that a lot of times in schools, we're not getting many people getting sick from that. So it's where the increase of people getting sick is more at home than at schools, and especially with people who have not been vaccinated and they're exposed to those people. So yes. Thank you, Christina. Another question that we received, and I'm not sure if the question was for Robin. If anybody has information, just go ahead and jump in and add in. The question is, we're asked, what are we doing to determine what type of variant we have, is the question.
Sí entiendo la pregunta, es que si tenemos
yes, I understand the question. What proof are we using to, or what tests are we using to understand the variant? And the answer is that we are using tests, genetic tests, to understand the sequence of the variant. For example, all the information that we receive of the genetic information of the virus, and also then we can use this information to classify the variant of the virus. Thank you, Robin. If anybody else wants to add to that, please go ahead. This is the last questions that we made for today. But before we finish this presentation, I want to ask you, what information is important to you that you want to share with the public, again, about COVID or the protection for the kids? If you wanted to say something, one person at a time. Who's going to go first?
Yo puedo ir primero, está bien, Priscila, no hay problema.
Yes, I'm going to go first.
Definitivamente, dos cosas.
Definitely two things. The first one, we talked about the tests, the testing. We want to let everybody know that we have a line in Spanish only, so we know that the testing is limited. But if there is a way that we can help if our Spanish line can help you to get an appointment, so we want to make sure that people get an appointment. So the Spanish line is 707-565-4701. That's the phone number, 707-565-4701. This is for the families that speak only Spanish, and so this is very important. Yes, I want to recognize too also that these are hard times for everybody, and especially seeing this wave of infections, and testing is important, and also with the kids going back to school. So I ask the same, take time as a family, talk to your kids about the concerns that you have, that they have about going to school, and that they take that time as a family and talk about the steps that you're taking to protect yourself, and even between families or relatives to take the measures that there's not like a big reunions, especially if you know that somebody there is not vaccinated. And then also, like Denny had mentioned before, reflect a little bit about how to protect each other, so that we can keep our community safe and be conscious and take all the measures that are needed to protect ourselves and be safe, and especially take the vaccine so we can have that immunity. Thank you. Paloma, did you want to share something?
Yes, thank you.
Yes.
I'm one of the public health nurses who works with the schools directly. And the best advice that I have for you, how to keep your kids safe at school, two pieces of advice. One is, as has already been mentioned, get your family vaccinated so that your children aren't getting exposed to COVID and aren't bringing it to school. And secondly, we really believe in how well masks work to protect everybody, especially our kids. So talk to your children about the importance of masking. Make sure they know how to use their mask properly. Make sure they keep it on all the time when they go to school.
Thank you. Ok, lo que dijo Paloma es que les da dos consejos a los padres y los consejos son de que vacunen a su familia, a todas las personas de 12 años de edad y mayores, que los vacunen. Es muy importante para toda la familia. Y también, número dos, que alente a sus hijos a que usen su cubreboca de una manera segura, que esté usada de una manera
the translation, that's why I'm not speaking.
Son importantes contra la pandemia. Así que son los dos consejos que dio Paloma hoy. Robin, ¿quería dar un consejo hoy?
Robin, did you want to give any advice today?
Sí, sí puedo compartir que.
Yes, I'd like to share two things. One is it's imperative that people get vaccinated. It's one of the solutions to beat this infection. And the second thing would be, in the event that there's a case in your home, please right away call and talk to the county to let them know when you call in, and the information that they're collecting is very important. My own team, we're using this information to understand the experience, especially of the contagiousness in the community, so that we can talk and work on this to prevent more infection in the future. I would also like to remind you of the basics. Remember the basics, washing your hands, use your masks, maintain your social distancing, especially when you're in large groups. Also, avoid the big reunions. Also, if you or one of your family members, remember to quarantine.
No olviden de visitar a nuestro sitio web, socoemergencia.org.
Also, if you need more information, make sure to visit our website, and there's a lot of information and resources that can help you. The number that you could call is 707-565-4701, and they can give you information about resources and things that can help in the community. So thank you for everyone that was here, and especially everybody who helped us, everybody in the county that helps on this effort, and also our interpreters, Juan Morales and Elizabeth, the ASL interpreter. And we also like to give Priscilla Rodriguez and Anela Pandena and Robin and Paloma and Kira y a todas las personas que everybody who's taken part in this